Traffic was always terrible. And because I have chronic migraine, I had to rely on a family member or rideshare app to get to my doctor's appointments. Then there was the waiting room, the bright fluorescent lights, the smell of other patients' perfumes. I was surrounded by all these triggers. Then came telehealth.
I struggled for years before I finally saw a doctor, got diagnosed with schizophrenia, then became stable. So I wasn't about to let my healthcare lapse when the pandemic hit. Virtual appointments and phone calls with my providers gave me flexibility. I could maintain care, stay up to date with my prescriptions, and keep living a healthy life. I still prefer seeing my doctors in person, but I like having telehealth options too.
At the height of the pandemic, my patients didn't have to choose between continuing treatment and risking exposure to COVID. Telehealth made that possible. The rate of missed appointments plummeted. It got easier for patients to visit their doctor. It even allowed providers like me to help more patients each day.
Telehealth lets me get treated from the comfort of my own home without having to worry about travel logistics and expenses.
Being able to call in, even if it's for 5 minutes, is life-saving.
My patients can make appointments without worrying about missing work, finding childcare, or navigating transportation issues.
So what does telehealth mean to me? It means receiving the best quality of care on my own terms.
Being able to touch base with my providers between in-person appointments.
Empowering patients with more options.
Millions of patients and healthcare providers benefit from access to telehealth. By crafting policies that balance telehealth access with in-person care, policymakers can make optimal patient-centered care a reality today and for years to come. Learn more at telehealthadvocates.org.